This segment is sponsored by Lighthouse Dental Group.
Lighthouse Dental Group treats more than just your smile.
I had the chance to hear about how they are educating their patients to keep their oral health in top shape even between visits from registered dental hygienist Jason Prillwitz. Take a look. Well, we are here at Lighthouse Dental Group, and today is all about at-home care. Now, Jason, how important is it to make sure that we're keeping up this oral care at home?
Well, it's extremely important. For one of the reasons that with poor home care, if you do have poor home care, which many people do, you're going to be at more of a risk of cavities and periodontal gum disease. So we always stress with our patients, the 2-2-1 method. Twice a day brushing, 2 minutes at a time, once a day flossing. By doing that, you're going to be able to cut down on high blood pressure, diabetes, cardiovascular disease. Alzheimer's is a new one that we've been learning about. So it's always very important, if you want to also save money, employ good home care so you don't have to spend a ton of money here with us to get you in tip-top shape.
Well, those are two big ones, saving money as also preventing diseases. Well, you've got a couple different things to show us here that some look a little bit new to me as well. So when someone comes in here to Lighthouse Dental Group and we're talking about oral home care, what are some different options that you're giving your patients?
Well, options, probably the most important thing is when it comes to good home care is a power toothbrush. The world's best manual toothbrush person can still be outdone by a power toothbrush. It has a 2-minute timer built in, and people who do buy a 2-minute or buy this power brush that has a 2-minute timer, when they come back in 6 months, we're floored at how well that the gum tissue looks. The tissue is nice and tight, nice and firm, it doesn't bleed. And it takes all the motion out of having to up and down, side to side. All you do is turn this on and gently walk it around your teeth.
I think that's the one thing too, is that people maybe have an idea that a mechanical toothbrush is more work, but you're saying just turn it on and go. It's kind of the lazy version, but more effective.
Much more effective, based on what we see when they come in. Tissue's nice and tight, doesn't bleed, and does great. So, but as long as we have the patient first try it out, then a lot of times 90% they will buy one because they're so impressed with how it is. Also, if you do happen to brush too hard, the handle will highlight in red, tell you to ease up. So people who might brush too hard and have gum recession, this is a great way to cut down on gum recession. And
share a little bit about that, because I think a lot of people think that they're brushing hard and getting everything out, but that's not necessarily what you want from people. They don't want to be doing a lot of damage.
Right, most people think brushing harder is better, and also a toothbrush that has a medium or hard bristle toothbrush. We find out that actually causes more damage. Gum recession, tears up the gum tissue, so the best way is soft bristled toothbrush, but all power toothbrushes come with a soft head.
There you go.
And so that's the best way to go. So when it comes to good home care, a power toothbrush is a must if you are serious about having good home care.
What else do we got? What else are we looking at here?
Next thing is toothpaste here. So if a person does have a high caries rate, which means lots of cavities and sensitivity, they can purchase this. Now, normally this is only available at the pharmacy. You usually can't buy this over the counter because it's super strong, fluoride concentration. But it does a great job of cutting down on the sensitivity, and people who come back 6 months later are floored at how well this works. So if a person is serious about less cavities and less sensitivity, ClinPro, is a must. So we are a big advocate on this as well. So also, a lot of people, when they do floss, a lot of people don't have the dexterity skills of flossing well. So a go-between or a proxy brush is a great tool to use. If I can open this up here.
I've seen a lot of people use those, especially if they have braces, and you're saying these are also for the individuals that don't have braces.
Anybody. So people who have a hard time wrapping floss around their fingers, and they just have a tough time of flossing, or don't like flossing, they can just use a go-between. And then just, kind of like a toothpick.
I would imagine for individuals that might have arthritis in their hands as well, this is a good alternative.
Yes. And so people can watch TV, they can kind of poke around. So this is better than nothing. Obviously, I prefer the floss around your fingers, but not everybody can do that. If you got big hands, that's not going to work. So a go-between, we're always passing out a ton of these to patients who tell us they don't like to floss or they just can't floss. So that actually is great too. Now, for people who have periodontal gum disease, which means the tissue is spongy, they got deep pockets. It means that there's a lot of bacteria located below the gum line. And that can lead to, bone loss, because the bacteria will begin to eat away at the bone that holds the teeth in place. So a good way of trying to control that is by something called Perio Protect. So we actually make custom fit trays for you that will fit in your mouth.
There you go. It's the fashion statement of the year.
And so for 15 minutes, you wear them, when you first start out, you'll wear them for about 15 minutes 3 times a day. And you'll actually put a special hydrogen peroxide gel into the tray. You put it actually into the tray, and then you just pop it in 2-3 times a day, 15 minutes at a time. And what will happen is that the gel will seep, will penetrate below the gum line. And it will then kill the bacteria that live below the gum line, which don't need oxygen. So that's a great way if you're serious about having good home care at home and also having good overall health, is to think about Perio Protect if you have periodontal gum disease. Next thing is that another, probably one of the best tools that we have to educate patients on what gum disease is this. So for a person who has perfect gum tissue, the tissue is nice and tight, nice and pink, and it shrink wraps nice and tight to the neck of the tooth. And when that is said, when that's being done, the pockets are between 1, 2, and 3 millimeter pocket. But gum disease is when the pockets become greater than 3. So you start to see the tissue becomes red and swollen. It starts to pull away at the tooth. And then, so this is what gum disease is. When we measure with our probe, we'll actually sink farther down below the gum line. And so that is how we educate patients on what healthy gum tissue is, which is right here. Healthy gum tissue compares to what is unhealthy gum tissue, where you've lost bone due to bacteria eating away at the bone, and the tissue is nice and red, and a lot of times bleeds.
Well, if you're serious about at-home oral care, the folks here at Lighthouse Dental Group have a lot of options and resources to help you out. Well, they are doing a special offer. Mention Hometown Living and you'll be entered to win an electric toothbrush and teeth whitening system. That is awesome. You can visit them in Bridgman, Michigan. Their phone number is 269-465-3001. You can visit them at lighthousedentalgroup.com or also on Facebook. More Hometown Living when we come back.